Facing full arch tooth loss forces an immediate, difficult financial decision. Beyond the medical diagnosis, you have to choose a path for your recovery while weighing a massive disparity in cost. A traditional removable denture averages $1,500 per arch. By contrast, a fixed all-on-4 system costs around $25,000. This extreme price gap leads to decision paralysis. Most patients see the lower upfront price and choose dentures immediately, unaware of the biological and financial consequences. A traditional denture provides a removable cosmetic fix. All-on-4 implants create a permanent, load-bearing extension of your skeleton. To find the real value, we must evaluate the biological decay in your jaw, the medical prerequisites, and the cumulative costs over 10 years. That $25,000 price tag represents a prepayment for a completely different medical outcome over your life. Traditional dentures sit on top of your gum line. They stay in place through a combination of suction, mouth muscle control, and daily adhesives. Resting on soft tissue limits their function. Conventional dentures only restore about 20 to 30% of your natural chewing power, which often restricts your diet to softer foods. This cross-section shows the mechanical problem with that passive design. Natural tooth roots stimulate the jawbone to keep it dense. Without that pressure, the bone begins to resorb, shrinking downward and inward over time. As the jawbone recedes, the dentures lose their foundation and become unstable. This internal bone loss eventually changes your profile, causing the lips and cheeks to sag into a sunken appearance. The all-on-4 system uses 4 titanium posts surgically embedded into the jawbone to anchor a permanent arch of teeth. Success depends on osseointegration. Osseointegration is the biological process where living bone cells fuse directly to the titanium surface of the implant. Once integrated, the prosthetic provides nearly 100% of your original bite force. You can eat tough or crunchy foods with the same confidence you had with natural teeth. These titanium posts act as artificial roots. They transmit chewing forces into the jaw, providing the stimulation necessary to stop the bone from dissolving. Implants do require specialized maintenance. You must commit to meticulous daily hygiene using water flossers and specific tools to keep the gum tissue around the posts healthy. Choosing between these options determines whether you preserve your skeletal structure or allow it to recede year after year. Money alone does not guarantee access to implants. Your body must be biologically capable of supporting the surgery. The baseline requirement is systemic health. Your immune system needs to be strong enough to manage the healing process after an invasive jaw procedure. Conditions like uncontrolled diabetes and severe autoimmune deficiencies prevent bone from healing properly around an implant, making surgery unsafe. Heavy smoking restricts blood flow to the gums and bone. This significantly increases the risk that the implant will fail to fuse with your jaw. Sufficient bone density is required for a stable anchor. However, the all-on-4 technique uses angled rear posts to utilize the denser bone at the front of the jaw, allowing patients with moderate bone loss to qualify without needing complex bone grafts. Some medications for osteoporosis, specifically bisphosphonates, can also affect how the jaw heals and require a consultation with your primary physician. For patients who fail these systemic health checks, traditional dentures represent the only medically safe path forward. To understand the actual cost, we must look at the cumulative expenses at the 10-year arc. Dentures involve a recurring cost cycle. Because the jawbone shrinks, the base of the denture requires professional relining every 1 to 2 years just to maintain a usable fit. This projection tracks the total expenditure of both solutions over a decade. The denture line starts low, but it stair-steps upward every few years as you pay for relines and eventually purchase a full replacement set. When you add the cost of daily adhesives, soaking tablets, and specialized cleaners, the total expense for a single arch of dentures can reach $15,000 over 10 years. The all-on-4 timeline shows a massive initial spike, but the line remains flat thereafter. Outside of routine dental cleanings, there are typically no recurring structural costs. Between the 15 and 20-year mark, you hit a break-even point, where the maintenance of dentures actually costs more than the one-time investment in implants. To manage the high entry cost, many patients use financing plans to turn that one-time investment into a predictable monthly payment. A decade with dentures creates a recurring financial and biological drain. The all-on-4 system functions as a fixed investment in long-term oral infrastructure. The decision is a trade-off. You can pay with upfront capital and surgical recovery, or you can pay with gradual bone loss and a lifetime of recurring fees. Traditional dentures remain the primary choice for patients facing significant health restrictions or a short-term budget. This is the correct path if your immune system cannot manage the healing process, if you cannot quit smoking, or if a 5-figure financial commitment is not feasible. In these cases, a well-made denture is a medically necessary and reliable prosthetic. All-on-4 implants are designed for patients who prioritize long-term function and bone preservation. This option is for healthy candidates who want to protect their facial structure and are willing to view the cost as a multi-decade investment. Look past the initial sticker shock. Consult with a specialist to evaluate your bone density and choose the path that fits your medical reality and your life 10 years from now.